Thanks for staying with us. So on our Healthy Tuesday segment, we'll be discussing ways to improve our health, boost our immunity against sicknesses, how to cope with medical costs, prevention of diseases, and consistent medical checkups. Joining us on the show is a friend of the house, Dr. Tuyi Mabawondu. Welcome to the show, sir.
Welcome. Thank you so much. It's a great pleasure to spend some time.
Back, yes.
Yeah.
You see you everywhere else except for our show, but don't worry, we're happy that you're back. So, right before you came in, we talked about cost of food. The economy is not smiling at anybody right now. Things are difficult. Everybody's trying to do their best to avoid going to the hospitals. On that note, anything, just manage it in the house because you don't know what the doctor will be pricing. So how do we boost our immunity? How do we strengthen our systems this season especially?
Yeah, thank you for this discussion. It's very apt. And please, I want Nigerians to listen. Now, the only thing you have is your body, all your aspiration, all your decisions, all your actions, all your buga, everything you want to do is inside with your body, okay? Your body must be appropriate for you to do all those things. So that's the only house you have. You have to carry it along once you die. You can't just run away from your body, okay? Now, inside this body, you define your goals. Inside the body, you aspire, you want to be whatever you want to be. And it is important that that body must be understood and taken proper care of. Because without the body, there's no human. I've not seen anybody acted outside his body. Okay? So let us consistently put attention to what our body is. And the body is a beautiful intelligence. Everything structured together to keep you alive, to make you think. In fact, it has the best warning system, early warning system for anything that's going to happen to you. Whether you're going to fall sick, the body quickly warns you that, listen, so thing is happening somewhere here. Please pay attention, okay? But most of the time, we don't pay attention. And sometimes, when we're trying to pay attention, we pay attention wrongly. And then here we're in Nigeria. You've discussed, I've listened to all the challenges of economy, food, money, debt, and all those things. It's weighing down on our body. Is it going to affect our body? Because in reality, I can't see you. I can only see your body. I can see your head. I can see your hand. But you exactly I cannot see. So you use your body to do everything you want to do. Now in Nigeria, how do we pay for health care or health services? 70% is out of our pocket. You have to dip hand into your pocket to pay, which is too bad, okay? The National Health Insurance came on 2005 or so, or thereabout. Up till now, we've not done 5%. Covering people. So you cannot say that I'm buying insurance, that I'm using the insurance to pay for my health issue. So you still have to put that in your pocket. If you cannot get money from your pocket, you have to call your family, you have to call your church, or your association you belong to, or call people abroad to help you pay your. It's not too tidy. So the best thing any one of us could do is to work fervently and assiduously to ensure that we don't fall sick unnecessarily. And hit those early warning systems the body is telling us. What makes it more confounding is that if you look at our environment, Nigeria, for instance, malaria were number 1. 27% of all the malaria in the world resides in Nigeria. Okay? Tuberculosis, you can be rest assured. Out of 300, close to 300 people out of 1,000 with tuberculosis in the world are in Nigeria. You know, HIV, 3 out of 100 in Nigeria. So apart from that, we have the burden of other illnesses, okay? Diabetes is there, hypertension is there. In fact, I got so stressed in the past week because a lot of young people that I knew were falling down. About 5 of them were dying. Just collapse and die, collapse and die. So how do we now discuss this? What do we do? How do we go about this thing? So it becomes important that all of us should first of all understand that we're nothing without our body. You can't become whatever president without your body. You can't. We saw what sickness did to Nigeria when some people were sick, when some leaders were sick in this country. So please, let's pay attention to our body because there's no money. And then you look at it, the cost of medication. Look at ordinary small medication to stop diarrhea that used to be 1,000 something, is now 7,000. Everything is just going up. Even yesterday, I had to shout when somebody needed to buy some medication. So it becomes important that we have to honestly look at our body and do what we need to do. Now, let's get to what are we supposed to do? First and foremost, you have to show love to your body. You have to show love to your body. You have to take care of that body. And then you have to, listen to early warning signs. Don't always think that you know all. Don't think that there's somebody at the corner there who can advise you better about how to take care of your body. If the person is not acute enough, have some the knowledge to do that. So medical checkup is actually the best thing, and it starts from you. Medical checkup does not start from the hospital, it starts from you, okay? Because here you are, in your house, you can still check your weight. You can check your height. You can check your blood pressure. Know your figures. That's the starting point. What is your sugar level? What is your blood pressure? What is your weight? What is your height? What is your cholesterol level? Know your... In fact, in reality, every home should have those basic things to check all those things. When you feel headache and it's not going on, put your hand and do your self-checking blood pressure. A lot of watches, smartwatches now, can do quite a lot for you. If you can afford it, great. If you cannot afford it, the simple one that can check your blood pressure, even if you cannot check your blood pressure at home, walk to a nearby pharmacy. They do it free of charge. Enter an hospital, they do it free of charge. They'll check your blood pressure for you free of charge. And I also want to encourage our health providers, hospital, pharmacy, to help people check their blood pressure and some things and give them advice, okay? That's the starting point. Secondly, let us appreciate that everybody needs health check. Whether you're a baby, adult, or whatever, you need health check, okay? Now, don't discountenance your family history. Because in reality, we find that quite a lot of diseases has foundation in the family, okay? If in the family, there's hypertension in the family, take note. And look at those things that can honestly help you to reduce hypertension. If you tend to be overweight in your family, take note. Watch out and make sure that you don't get overweight. If there's diabetes, also take note. So always find out why should father die at this age? What killed grandma? Do we have history of cancer or somewhere in the family? Know your family history. That's the starting point. You cannot then neglect it. It's not by mistake that in the Bible people will keep reading this bond, this bond, this bond, that. Also know your family history, especially the health history of your family. That is very essential, you know. Now, schedule at least to do a check on your body. There are organs checks. You know, one of the organs that actually kills person easily, apart from general infection, you know, infection in the sense that people pick chest infection, they pick tuberculosis, they pick HIV. Apart from those general infections, your heart becomes the first thing to look at, because anything that raises the blood pressure, anything that compromises the supply of blood to any organ will lead to collapse at any point in time. So, and then I advise people to actually make sure that they have a number of one health worker they can talk to, who can guide them on what to do, when to do it, how to do it. For us in Nigeria, access to universal health is not available because government does not even have the money. We do maximum we've done for health spending is 6 point something many years ago of our budget. The rest is only 4%. We don't have the money. We don't even have money to manufacture drugs. Right now, to manufacture drugs has become a problem. Okay? So we have to import, and we are importing dollar-based. We don't have the money. So the best thing, eat right, sleep right, do your checkup, listen to your body, call a person that can give you proper advice. Let's start from there.
Okay, doctor. So eating right now, I want to believe we need money to buy the right food. Gone are the days where you can just walk into the farm and pluck vegetable and pluck this and mix together. Right now, to have a healthy diet based off of all these things you're saying, because what would work for me would definitely work for Mariah. I need to do a diet that is restricted to what my body needs at the time. And it's very expensive to eat quality in terms of, you know, as against the quantity. Because for the typical guy out there wants a plate of food that will satisfy and hold him because he doesn't know when next he may be seeing the next one. So when you're not picking on the vegetables and all of that, it will not satisfy you. So how do we eat right, you know, in the face of all of this? What are the best ways we can just try as much as possible to eat right?
I actually feel your poster, what you raised, is very concerning. That now to eat, because look at it, 46.3% of Nigeria are malnourished. 43.6%, that's scandalous. So the starting point is actually, you know, we must have a culture. First of all, your locality, you look at it. What is the real main food? What are the missing links? Okay? Now, everybody, I'm able to say that everybody must try to be, to grow something tiny. Either inside a bucket or whatever, grow something tiny, okay? Now, what is happening most of the time is junk food that we tend to prepare. In other parts, people that's quite concerned about that is that they tend to look at those people, fast food that people do and try to go back and say, listen, the salt content is too much, the fat content is too much, and all that stuff, but that is not available here. We should eat as natural as possible. Good enough, we're not having a lot of modified food in our environment. Yes. So, yes, we should try to eat as natural as possible, you know. I know the only way you can cut cost of your food is actually to go back to those basics, like plant-based protein. Plant-based protein, your beans, is equally expensive now. What can you grow? So now it becomes important that even at the level of the local government or state, they have to look at it, how to make food provision. But I know that Lagos State has one big food hub they're building around Ketu in Ekwe area. So we want to see, apart from the state doing it, are we seeing the local government also doing such to make sure the food is available? In all my journey around India, the population of 1.4 billion people, food is one of the cheapest things. I still wonder how they do it. Food is one of the cheapest things. And most of these, their food are actually, because of their religion, they're actually plant-based. They're not taking all those meat. In fact, quite a lot of them don't even eat meat. Except you come to Haryana, no, not Haryana, or you come to Hyderabad, where they do a lot of biryani. But basically, they are plant-based food, and they've talked with their people there, and they've actually looked at how to provide those kind of plant-based food. So we need to work with our nutrition people. We need to work with the local government. We need to work with the state government, because, you know, eating right is not just you. When you don't have money and you will enter in another place. We need to have a consistent plan, either at the local level, you know, at the national level, on how to make food supply adequate. And everybody should have what we call a base. Your own base may be corn, some may be sorghum, some may be gari. That's the base. Then you then try to add other things to it. So people must be able to learn to rear some little animals, or, you know, or even plant some fruits, so that at least they can supplement the cost of feeding. It's challenging. Okay,
so aside from, because whenever we talk about managing our health and boosting our immunity, we'll say eat right, and they will say eat vegetables, eat this and that. You know, aside all of this and exercise, what else are those things that we must do to, you know, to boost our own immunity? Sanitation. And if we must even eat, some people will say don't take milk. You know, what are the best food that are locally available? No, sanitation. First of all, let me tell you, we should not underestimate the importance of sanitation, because if you maintain health in terms of good environment, hand washing, I'm sure that one will not even cost you a problem now. It not cost you money. To wash hand. To wash your hand will not cost you money. To clean your environment. NEPA not bring light. To clean your environment will not be a problem. It won't be a problem to you. Ensure that is done first. Okay. What sanitation, you know, hygiene and sanitation does to a family is far more than what plenty drugs do, because you are first of all cutting off diseases and infestations that can compete with your food. Okay? So you need to do that. That is key. Okay? Secondly, seek within your environment. Within your environment, look at what you can. We mention food, we mention exercise, we mention, you know, proper sleep, okay? Proper sleep. Sleep. Because there's a lot of stress. And then the other thing is that what I've observed is that the substance abuse. 2 weeks ago, I was delivering a talk with the NDLA on Drug Day. The level of substance abuse in Nigeria, all over the world anyway, even in Nigeria, is excruciating. It's quite concerning. What do we do about that? Because at the end of the day, one of the things that kill these young people easily is one of those substance abuse. When you say substance abuse, I'm talking about hard drugs. But what of the pharmaceuticals? They need money to buy. Some people will just overdose on certain. And you say sleep now. They'll say I cannot sleep. Yes. You self-medicate. Yeah, they make those things. Of course, normally,
if we have a proper structure to dispense drug, you can't go anywhere. Nigeria is the only place I've seen in my recent journey everywhere where people just enter a place
and
just buy drugs
off
and
the
go away.
counter.
You need that clear counseling on what to do. And I'm saying emphatically now that we should give more attention to all those tiny things. My friend, lovely guy, is one of the big bikers around Lekki. You understand? Gently, he used to work with LNG. He had malaria, entered one of the pharmacies and bought the dog and had kidney failure. He's done how many transplants now?
Yes.
Whenever I look at the guy, I just wonder, you are now like this? So that is why some of those decisions we take could be quite challenging.
Please, Oga, please calm down. Somebody can go to the pharmacy, buy malaria
the wrong
I won't mention his name.
No, not his name, but I'm just talking about that. What kind of drug would you just have kidney failure?
Yeah.
It's like fake drugs.
You see, the challenge of fake medication, even for me, I have to be very careful when I'm asking people, do the one with scratch card, do the one with this, make sure that this and this, try to do, I try to be so specific in where the drug comes from. Because now, look at malaria. If Nigeria has 27% of the burden of malaria worldwide, you know what the profit is, people selling anti-malaria. That one isn't very expensive now. So, and now when the drug is now fake, what do you do? So that's how my wonderful, lovely friend, Pig, when I failed, of course, the wife left him. Of course, he had a lot of problems. He can't get money.
Wife, leave her.
Wow.
This is, it's not something, some of us, in the past few days, a week or so, I've been quite depressed. I have to actually look for things that can make me talk because I was losing people like this. And I was looking. Some depression because I couldn't continue with the medication she's using. Of course, she died.
Hey.
Still, I was still counseling and talking to her that, listen, you must use your medication. Of course, she died. I also felt bad. Why should you die? Why are you in a hurry to die? So it becomes important that all of us, I don't care if you want to become President Trump or whatever you want to be, you must have body. Where is aspiration with that body?
How do we know these right drugs when we go to the pharmacy to purchase? What are the criteria? What are the things?
Okay, the first thing is this. Watch out. When you see a drug manufactured and not having a dark number, that's a signal. Okay. That's number one signal. Secondly, we've insisted on a check process whereby you scratch and send a code. Always don't just take it for granted. Confirm. Thirdly, you must know that some drug will not work well for your body. There are drugs I don't take.
Hey, how you know that one now?
You understand? So
my friend have used it. BC went there, she bought it, she had kata, she bought that thing, it worked for her. How will I know it will not work for me?
Now, medicine has moved from generalized to specialized. What I mean by specialized is that now we're doing more of genetic drug, dosing. Is this drug going to work for your body? What's your genetic component? That's what we're, incorporating into the health.
Then you must go for admission.
Now, the point is this: you can't always be too wrong when you speak to a doctor with a bit of experience. You can't always be too wrong because you ask you the question: are you using this drug? Are you using that drug? You cannot combine this and this because they're drug interaction. Okay, so for now, let's love our body. Try to talk to a medical practitioner. All those simple things that we're supposed to do to keep our body well.
You have transferred the depression to us.
No, don't be depressed. Don't be depressed. I've told you, so just take action, It's good to have money. I pray that we have as much money as we have. It's good to have beautiful houses and beautiful cars and be able to travel and all. But you need body. You need body. I've not seen Holy Spirit acted out of the body.
BC. No, I was going to joke with doctor that BC acts out of the body because she have universe and all that.
I still need body.
You need body. And the body must be healthy because even when your soul or spirit is inhabiting a terrible body, you just say, I'm tired.
You can't even manifest anything.
He said, I am tired. Let this thing go. It just wind you down. The body just wind you down. So we need, if you say, stand up and walk a bit, do it now. What is the big deal about walking a bit? If they say drink more of water, drink now. Okay? If they say take fruit, take now.
My husband always laughs the abs at me, say, Muriel, I don't want to be stressed when we're old. You don't stress me. Every day you see me there waking up 5 o'clock to go and exercise. You're here sleeping. I'm always sleeping.
Please stand up.
Honestly,
Please,
it's a lot of work.
When you've done that for a few months, you won't be able to go to stop.
Yes, you won't stop.
The critical point is for you to, to start and stay with it for that short period. When you don't do, you say, oh, I've not exercised. You stand up quickly, say, let me go and do. Even here, you start doing your leg like this.
It becomes a good habit.
We have to wrap up. But thank you so much, Dr. Tuyi, for coming to, in fact, we need to bring you back because what I like about you, you bring it home to reality, which is always important for us to know the next steps. So we'll definitely have to bring you back very soon. But thank you so much, sir, for sharing your insights on this.
Thank you, sir.
Anytime. So please love your body. Yeah. Love your body.
Okay, that's all we can take on today's show. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.